Hi everybody, Dr. Brian Hooten here at our Hooten Family Healing Center in Dallas, Texas. I'm excited today. I'm going to cover essential number 2. Now there's 5 essentials to being healthy. We all know that eating is important. How many of you like to eat? Exercise is important. How many of you like to exercise? You know, I personally don't like to exercise. I don't wake up in the morning thinking, woohoo, it's time to go to the gym. But I do enjoy the effect of exercising. So exercising is important, you know, sleep, peace management. We like to build peace instead of try to manage stress, toxicity, and then you know, your mindset. Those are part of the essentials. But the number one most important thing I'm going to cover in this short video is the health of your physical nervous system, your spinal column, the way your brain and your body are working. You know, your brain is actually the power supply to your body. You can do all the other essentials properly. You can eat right, exercise, and do whatever. You can eat junk food and smoke and do whatever. But if your brain is not getting to your body at 100%, it is impossible for you to be 100% healthy. Now, that's the data, obviously, that's Physiology 101. Your brain and your body have to be communicating. In our practice here in 17 years, I have never seen a sick person with a healthy spine. Let me say that again. I have never seen a sick person with a healthy spine. Now, what do I mean by sick? Anything from headaches to thyroid, breathing problems, bladder problems, colon problems, acid reflux. I've never seen somebody with a condition that has a healthy spine. Now, I wasn't always this way. I wasn't always this passionate about it. I owe my entire life to this type of care, to this type of chiropractic, what we call functional or correctional type of chiropractic. You know, today I have a wonderful life. I have a 6-year-old daughter. You know, we're in the summer of 2017. You know, time seems to be going by so fast. I remember when she was, you know, a minute old and a day old, and she has this awesome start to life. And we just love watching her flourish in school and all the different camps. If you have kids, you know what I'm talking about. It literally does take your joy to a whole new level. My wife, radically healthy. We have a wonderful house. We have a wonderful life at home, lots of joy. My life may look somewhat good today or great or normal, right? But it wasn't always this way. When I was a child, I did not have my health. And when you don't have your health, it is hard, if not impossible, to be joyful. And you certainly can't be 100% at whatever it is you're trying to do. So as a kid, you know, we care about playing games and being with our friends and being outside, you know, whatever it is you enjoy doing. I couldn't finish a soccer game without having an asthma attack. And I'm sure there were times that I did, but the majority of the time, all I remember is puffing on this inhaler. I would have to take my medications to school in elementary school. The nurse had my medications in her medicine cabinet for when I got sick. I remember that when I was as little as 5 years old. See, I came into the world sick. From a very early age, I was in and out of the hospital with respiratory problems, you know, breathing problems. My parents debate on how many times I was in the hospital before I was 2 years old. And we didn't complain about everything. If you would have asked us how we were doing, we would have said, yeah, everything is great. You know, we thought it was somewhat normal because that's how I was. At 8 and 9 years old, I remember my dad having health problems. He started having back issues. I remember scared me to death one time where I was watching him play tennis and he collapsed and his back had gone into complete spasm. I mean, we literally couldn't move him. It was like all that dead weight. We're trying to get him in the car, you know, to take him to the doctor or whatever. With my health, with my dad's situation, it was all drugs all the time. We went to the doctors. They gave us medications or injections. I was taking up to 5 prescriptions a day, including allergy shots every week. And again, we thought that was normal. And as time went by, because nobody actually told us how to get healthier, what to do about my lungs, my breathing problems, my immune system was crazy. I started having some kidney trouble. Nobody was telling my dad how to get his spine strong. We continued to get worse. Now, my dad, when he went down, was only like 40 years old. You can imagine if he had kept doing what he was doing, what life would have been like for him at 50 or 60. You know, nobody telling us how to get my lungs well. It was all these medications. You can imagine what my life would have been like at 20, 30, or 40. Again, we thought it was normal because that's what everybody tells you to do. Go to the doctor, ask your doctor about these drugs. So if you're in the middle of this health crisis, if you will, whether it's for breathing problems like I had or whether it's you or your children, Heart problems like blood pressure. My dad developed high blood pressure, cholesterol, and prediabetes. Thyroid problems, anything from your headaches down to gout in your toes, and anything you can imagine in between. An autoimmune disease, bladder problem, colon problem, acid reflux. Maybe you've been told you have an incurable autoimmune disease. Okay? Ultimately, the only thing that the system is going to give you is a drug. And we realized that when I started getting really sick at 13 years old. We wound up in a special type of chiropractor's office, somebody that cared about our overall well-being, our health, and she started adjusting us. And I remember my first adjustment. It literally felt like my spine erupted. There was so much pressure on my spinal column from falls and traumas and from a difficult birth. My mom was in 46 hours of labor, if you can imagine that. I was stuck in there pretty good. And I came into the world with this damaged spine, and consequently my body never worked right. At 13 years old, this special chiropractor started working on my spine to alleviate this pressure so that my brain and body could start working. Now, how cool is that? If you start getting pressure off your spine, no matter the situation, no matter what diagnosis you've been given, if you get pressure off your spine so your brain can now get to your body, your organs, your cells, your systems, so that your brain can actually get to your body doesn't have a choice but to start working better. Now, there's a big difference between trying to treat a symptom, right, and trying to get your body where it can work. See, when she started doing that, she didn't tell us that she was going to fix my lungs or anything like that. She started working on my spinal column so my body could start to heal itself. And as the days and weeks went by, I was needing my medications less and less. In fact, we threw a bunch of them out right off the bat. That rescue inhaler, that's all I remember using for about a year and maybe a dozen times. And after that, at 14 and 15 years old, I'm telling you guys, I'm standing here at 45 years old, 30 years later, and I do not get sick unless I get into poison ivy. I mean, there's some things that, you get into, you're going to have a symptom from, but taking a daily drug, taking an allergy drug, taking that inhaler, that is so far gone. We don't even have Tylenol or Advil in the house. My daughter, 6 years old today, or now, has never had a medication. Try that on. Never had even a Tylenol. She knows that drugs are there for the emergency room only and not something that we should be reliant on. So that's a big point. If you want to get out of that mess, if you're taking medications, if you know your body's struggling, if you know it's falling apart, you've got to start taking care of your spine properly. So if you're already in the office, you're well aware of this whole spine story. You know you've got to take care of it. If you're out there in the world and you haven't experienced what we do in our office or any of the 400 offices around the country that are certified in our protocols, then take this to heart. You've got to get your spine flowing. So if you're already under care and you know what your x-rays look like, here's a couple of tips you can be doing on a daily basis. I just want to show you my x-ray. This is my cervical spine or my neck curve, the arc of life. I think you can see that. Now, if you notice it's curved, that's from the side view. I will tell you, I work on this religiously. I work on it daily. At night, for you to help this curve in your neck, we've got these foam rolls. If you're not using these, you need to be using them. This is a beginner roll. Sometimes I step it up to the PVC pipe. I mean, I literally will sleep on this under my neck. The majority of the time, I have a blanket that I can roll up pretty hard, and I tuck that under my neck, but I'm doing this regularly. If I roll off of that, if you roll off of your rolls at night, or if it's hard to take, right, you can only take 5 minutes, that's okay. When you wake up in the morning, tuck it under there for a few minutes and start helping to get some of that cervical lordosis in there. That's not going to that's not going to adjust you, but it does help accentuate what we're trying to do in the office. You want to, basically, when you get adjusted, you want to keep that flow going and keep the momentum building. So things like this really help. If you have these, you need to be using them every night. Just work on it. Like I said, if it's difficult at first, work your way up. You can start with 5 minutes, work your way up to 20 or 30. Eventually, you'll be able to do that. Some people, because their head is so far out here, they've got to take the roll and put it on top of a pillow. That's fine to start with. Another thing to do right before you lay over this roll is do those little wobble exercises. Do 20 or 30 of these, 20 or 30 of these, 20 or 30 of these. Use your wobble cushion if you have those inflatable cushions. Sometimes I'll do it right there in bed, warm my neck up, and then lay over the rolls. Those work really well. If you have the traction units, you need to be doing those every single day. Obviously, I have it here in the office, so it's easy for me to do. If you have those at home, you need to be doing that at home every single day. Think of it like brushing your teeth. I mean, your teeth are important. How many of you brush your teeth? shouldn't we be taking care of our spinal column also? So there's a few tips and tricks for you. Share this video. I'm going to post it on YouTube. I'll post it on Facebook. Help people. If we could get everybody to start taking care of their spine, if we could get all kids to start getting their spine flowing and then change their diet even just a little bit, what would happen to the rate of ADD, ADHD in our population? What would happen to the rate of depression and even cancer? I mean, you start affecting people on a massive scale when you start getting their spine right. Yes, I've seen every condition that I can think of. Some people wait too late. I'm not going to sit here and tell you that every single person has made it, but 99% of the people that come in here, they conquer whatever disease brings them in. They get their life back just like I did as a kid, and I thank God every day that that person told my parents, his name was Bob, told my parents to take me into that special chiropractor because it changed everything. I owe my life to this. My passion is to see you heal, to see everybody in your family heal, to stay out of the nursing home. We will help you. We'll literally bend over backwards to do so. Remember, drugs are bad. God is great. He gave you a body that is great. Don't ever, ever listen to people tell you that you can't heal. You can heal. You just got to tap in to the right information and take the right action. It's Dr. Hooten signing off. We'll talk to you next time.